Lumps and bumps in orthopedics, pediatric orthopedics is not uncommon. I have to cover these 4 topics: the ganglion, osteochondroma, the swelling at costochondral junction, and vascular malformations. The ganglia is the commonest swelling around the hand and in the dorsal and ventral aspect of the wrist, over the dorsum of the DIP joints, and within the flexure tendon sheath at the base of the finger, which is known as sheath ganglion. And these are the clinical examples. And its size may be variable, and its increased size can cause discomfort and aching pain. The smooth, fluctuant, and transluminable swelling it is actually, but at times when there is rapid progression, it may be tensistic and tender, and in that condition it produces symptoms. And sheath ganglion can be painful while gripping. The management part, it should wait and watch at least for a few months, because quite a large number of cases, spontaneous regression is the rule. And if at all there is active treatment required, there are 2 clinical conditions: when it is cosmetically disfigured due to large size, or if there is aching pain causing much discomfort on day-to-day activities. The surgical excision under tourniquet is the gold standard of management, but even then, recurrence is not uncommon. So, these point to be counseled to the parents prior operations. Next is osteochondroma. This is benign hyaline-capped bony projection. It originates from physis, and usually it presents not before 2 years of age, but around adolescent phase, it becomes too much prominent and lumps are prominent. And these are few of the clinical examples. And complications. When there is compression over the nerve or tendon, or vascular pseudoaneurysm formation, or the fracture, or bursitis over the cartilaginous cap, or infarction, and at times there is gross deformity around the bones of legs and forearm, which causes limb length disparity. And one thing is very much important, though essentially it is a benign lesion, but at times there is malignant transformation. So, if the pre-existing swelling suddenly increases in size after skeletal maturity, there is a possibility of malignancy. The incidence in cases of solitary, it is less than 1%, and if it is in the diaphyseal atresia, then it is around 1 to 3%. And when to treat? If it is get bumped, there is need for wide resection, and if there is severe deformities of legs or forearm bones, the corrective osteotomy or reconstruction is needed. If you carefully note, you will find there is the lump and the undersurface of the calcaneum, which is extremely rare. In both the cases, this osteochondroma produces too much symptoms, and I had to excise it. After excision, patient was symptom-free and absolutely fine. Now the costochondral swellings. There are 3 common conditions which in our practice we face. The rachitic rosary, this is a costochondral enlargement, leads to characteristics appearance of rickets. And though even in India, this finding is very rare nowadays. And bifurcation of the ribs produces swelling at the costochondral junction. It is a benign, and it is an innocent lesion. Only assurance to the parents is the treatment of choice. And osteochondroma at times you may find. And this is an example of rickety rosary. And this is bifurcation of the rib. The arrow marks, if you carefully note, the bifurcation of the rib produces swelling, and this is the osteochondroma. And now the vascular malformations. It results from defective maturation of cutaneous sympathetic innervation, and here there is capillary changes are there, and endothelial mitotic activities are normal. And this condition never regresses. It may be slow flow or it may be high flow. The slow flow, the limb length disparity is not too much, but in high flow, the limb disparity is a problem. Now the question is, why in vascular malformation we the orthopedic surgeons are concerned? We are concerned because it produces limb hypertrophy, macrodactyly, skeletal deformity, and skeletal vascular malformations at different sites. And usually, according to the age, it progresses. But at times, when the infection superadded, that there is sudden swelling of the lesions. And in this case, if you see at the age of 4 years, on the left hand, the deformity is not too much, but at the age of 13 years, the forearm is too much deformed and swollen. And in cases of high floor deformity, the plain radiograph is done for bone morphology assessment, serial CT scanogram for LLD assessment, and Doppler ultrasound, and MR angiography. And these are the investigation examples. And treatment. Essentially, this is conservative by elastic stocking, maintenance of foot hygiene, avoidance of certain contact games, and at times there is need for arterial embolization, but laser therapy has practically no role for high velocity lesions. LLD needs treatment. Essentially, it is conservative. And if at all there is need for operation, epiphysiodesis, the percutaneous drilling is preferred. Because if we go for open surgery, then there is every possibility in the postoperative wound healing. And if the vascular malformation is too much, we just address the normal limb by shortening or by lengthening. There are certain complex forms of vascular malformations, Krippel-Tenoni syndrome and Parker-Weber syndrome. These are the clinical examples. And Proteus syndrome is another syndrome where along with the vascular malformations, there are malformations of the other parts also. And this is widespread involvement, and it causes macrodactyly, hemihypertrophy, scoliosis, kyphosis, and so on. In this particular case, there is also involvement of the brain. There was vascular malformation of the brain, and this patient was operated for that also, and I operated thrice for correction of the limb length disparity and other correction of the macrodactyly. Now her demand is for cosmetic reasons and for wearing the shoes, the correction of the fifth toe deformity and correction of the macrodactyly. Thank you.